afternoon, welcome to Camnet Midday News. My name is Amazing Katamanda with the headlines. Non-state actors advise not to trust politicians. Public health facilities to be fully stocked with medicines end of this week.
Team, the trajectory of the business looks very positive, and it looks like we'll be able to launch the ministry.
There's so much data.
Mom?
Yes, baby?
It says here, global warming and climate change is caused by the pollution from careless activities of human beings.
Wow!
Son, do you know I can turn my phone into a TV remote?
How's that possible?
It's so easy. Check this out.
Be smart, be fast with mega data from Zamtel. Get your 15 GB mobile data for only 100 kwacha, 30 GB mobile data for only 200 kwacha, and your 70 GB LTE data bundle with free Netflix, YouTube, Facebook, and WhatsApp. Visit our Facebook page, website, or service centers countrywide for more information. Zamtel, your digital lifestyle partner.
Thank you for staying with us in all the news in detail. Government has disclosed that medicine situation is not as bad as it's been portrayed by government critics in some sections of the media. Minister of Information and Media Director, spokesperson Tawakawana says health facilities are stocked to the capacity of 60 to 75%, contrary to the perception that public health facilities have no medicines.
Access to medicine is vital towards achieving universal health coverage. Universal health coverage means that all people have access to health services they need when and where they need them without financial hardship. However, this goal has been under threat owing to lack of access to medicines, a situation Zambia's Health Minister Sylvia Masebo had said was temporary as the government was trying to clean up the procurement system. While government has been making justifications, its critics have been making recommendations to improve the situation to safeguard people's lives. Tuesday, 29th March 2022, Minister of Information and Media Director spokesperson Tawo Kawana visited Challenge First Level Hospital, the University Teaching Hospital UTH, and Levi Manawasa Medical Hospital. At UTH, just like at Challenge, we were allowed to check on the available stocks and briefed on the drug status.
As you've seen, I think we have the essential drugs and we're able to attend to our patients. We might not have the desired stocks, but we have the stock that we're able to attend to our patients. Patients are receiving their drugs and we've not closed our pharmacy.
What do you mean desired stock?
Desired stock is having 100% stock. But as you can see that there have been issues of delayed procurement at the national level, and this has also affected us as institutions. But management has been trying very hard to ensure that we are supported to undertake local procurements.
UTH Senior Medical Superintendent Dr. Charles Mutemba spoke to us.
In the hospital, definitely it's not 100% where it used to be, but we're not at 0% in any way at all, because of the various sources of income that we have of drug acquisition. And also the method that we use is that we use protocols when we are actually prescribing drugs. Each particular disease, we have a protocol of which drugs to use. So there's also a rational use of drugs. So as we speak today, if we had an opportunity for you to see the pharmacy, we are quite well stocked. That is before the actual ZAMSA program starts setting in as it is. So at the moment, if you have to inspect the hospitals for admitted inpatient, we don't have the challenges or crisis of drug situation the last 4 months, because we have been appropriate source of income from the grant, from NEMA, and from the internal generous funds.
At Levi Manawasa Medical University, the situation was the same. Enough drugs, but not fully stocked, according to the pharmacist.
For now, I would say we are around 78% in terms of the ZAMSA is not doing very well currently, but what we are doing is we are buying most of our commodities because I think the grant has been increased. They are aware that the grant has been increased, so even our purchases have increased in terms of what we are purchasing now to fill up that gap from ZAMSA. So that's how we are managing the situation with ZAMSA. So we are buying most of our commodities as a hospital.
Ministry of Information and Media Director spokesperson Tabo Kawana is concerned that there's been a lot of misinformation on the status of medicines in the public health facilities.
Those facilities we have visited so far, I think you have been able to see that from Chilenge through to UTH, and now we're here at Levi Mwanawasa Hospital. The drug situation being painted is not as black a picture as the one that is being painted, especially on social media. There is a decent level of medication and being administered on patients and being given to outpatients.
And when asked about people being given prescription whenever they seek medical attention, Mr. Kawana said this has always been the case in a situation where the drugs are not available, but that the situation is being improved by the UPND administration with the effective implementation the National Health Insurance Scheme.
Not all medicines are there. Those that are not there, you'll be given a prescription. Even that prescription, if you are registered under NEMA, you will be able to access medication and the government will pay for you through NEMA. So what is important for all of us, especially you colleagues in the media, is to advocate that every person in this country ought to be a member of NEMA.
Patrick Soko, Camnet News in Lusaka.
The Zambian Congress of Trade Union Secretary General Cosmas Mukuka has charged that the cooperation between trade unions and civil society will help foster growth in the formal economy as well as advancing a broader social and political agenda in Zambia. Speaking during a leadership workshop, Mr. Mukuka notes that union members need to exhibit unity and allow people in authority not to divide their voice.
Stakeholders in the civil society and trade unions through the Zambia Congress of Trade Unions are attending a leadership program in Lusaka discussing matters of human rights promotion for all. ZCTU Secretary General Cosmas Mukuka says a divided trade union cannot progress. Mr. Mukuka has cited the division experienced in 2021, largely engineered by the ruling party then, a situation he says shouldn't have happened if members remained united.
To discuss a wide range of issues, more issues of human rights, including workers' rights, and we know going it alone will no longer be a viable option. We are coming from a regime where even me as Secretary General had difficulties to handle even my own trade union affiliates, where you could be paddling this way, you find that others are being used and they start shouting slogans that they are government and they can even score in that area.
And speaking at the same meeting, Gears Initiative Executive Director McDonald Chipenzi urges the participants not to allow those in authority to control them. According to him, this will make those in authority lose focus due to praises received from voices that are supposed to offer checks and balances.
Zambia is never okay. We must always be alert because the democratic space shrink like weather. Those who have done geography will appreciate that weather changes from day to day and from place to place, isn't it? So even the democratic space, you don't expect that it will be there for 5 years. No. Actually, the more we praise the new government now, the more we'll find ourselves being in a shrunk space because we will all go to sleep. All right? And yet, a lot of things will be done.
And Mr. Chipenzi says politicians should not be trusted fully because they change according to their positions.
We need to protect this initiative. The democratic space needs our alertness. The civic space needs our alertness. The media space needs our alertness. The moment we will say everything is rosy, yes it is, when the new government has come. But after that, already now, if you go in these corridors, people that used to meet you, when you call for a meeting like this one, they will come. Now they are running away. And in the next 2, 3, 4 years, you will never see a minister at your meeting like this. Then you see that now, nimbus clouds are forming over the democratic space. One thing that you have to be very, very careful of is never trust a politician 100%. Never. That I can assure you. Never trust a politician 100%. You can trust them 50%, at most 60%. Remain with 40%. Otherwise, you start suffering BP after you have been arrested by the same person perhaps you were campaigning for.
Sharon Kalimbola, Camnet News, Lusaka.
Prospective employees in medical field are hoping to be amongst those employed by government in various fields. A check by Camnet TV at the Health Professions Council of Zambia found long queues of youths renewing their practice and licenses, one of the requirements for one to practice in medical fraternity.
It has been a busy week for workers at the Health Professional Council of Zambia, HPCC, in Lusaka, following the recent advertisement for the recruitment of over 11,000 health professionals by the Ministry of Health. The health professionals have since the advertisement of the recruitment process been flocking to HPCC offices to get certified to ensure that they leave no room of errors when it comes to being recruited. HPCC Senior Public Relations Officer Terry Musonda says a total of 1,506 health professionals and a total of 9,301 renewals have so far been captured as at 14 hours on 29th March 2022.
Our appeal to practitioners out there is that HPCZ offices are operating throughout the country. We are talking about the office in Livingstone, we are talking about the office in Ndola and Kasama. Therefore, there's no need for all of us, for example, to come and cloud in Ndola or to cloud in Lusaka. We need to ensure that if we are in Kasama, we go to the Kasama office, which is taking care of Northern Province, part of Luapula and Muchinga. So,
and a medical licensed Samson Mwanza says there has been an influx of graduates specializing in medical licensing following its introduction in institutions of learning, and is hopeful that the government will capture more medical licenses in the recruitment exercise.
She's still doing my internship at Kanyama with the hope of this massive recruitment. We're hoping that we get an opportunity as a medical licensure, because from the look of things, we are flooded. Ever since the introduction of our course, there are a few medical licensures that have been employed.
Others spoken to have told this reporter that they have traveled miles to get to Lusaka in order to be certified and are hopeful that they will be among those recruited.
I completed in 2018. I studied environmental health, and with this recruitment, I hope that I will be able to find a job and also to help my family.
Have you been able to work from 2018, maybe even in a private institution?
No.
From what I've heard, it doesn't. You get everything at the same time. So as long as you have all the requirements, it's easy to get a license the same day. Yes. So far I think the process is okay because you don't have to wait for days to get your license. As long as you have everything, then everything will process the same day, and you're able to go and apply for the deployment.
Unemployment levels in Zambia have remained high, with the majority being the youths. The huge turnout of those wanting to be certified so as to get employed is a sign that the current administration should do more to create employment opportunities for the people of Zambia. Prudence Chota, reporting for Camnet TV News.
Speaker of the National Assembly Nelly Muti has amended her ruling made on the 23rd of March 2022 in which Kwacha Member of Parliament Joe Malanji was suspended among other Patriotic Front members of Parliament for protesting in the House. Making the announcement Tuesday, Speaker Muti says the decision allows review of Parliament footage which showed that Mr. Malanji did not participate in the process.
It has come to my attention after a thorough review of the proceedings of the House on Tuesday, 30th November 2022, that Honorable J. Malanji, Member of Parliament for Kwacha Parliamentary Constituency, did not participate in the protest. I wish to remind the House that all the Patriotic Front members of Parliament that were identified to have participated in the protest were written to individually to exculpate themselves. This included Mr. Malanji, MP. The leader of opposition responded to the charge letters through a single letter on behalf of all the Patriotic Front members. However, two Patriotic Front members, namely Ms. J. Nyemba, MP, and Dr. C. Chirufya, MP, responded individually to indicate that they did not participate in the protest. Upon a review of the video footage, it was proved that indeed these two Patriotic Front members did not participate in the protest and were accordingly removed from the matter. Therefore, the onus was upon Honorable Malanji to respond to the charge letter so as to indicate in his non-participation in the protest, as was the case with Ms. J. Nyemba, MP, and Dr. C. Chirufya, MP. Mr. Malanji, MP's failure to respond to the charge letter, therefore, led to the inevitable conclusion that he had participated in the protest.
Thank you for joining us on our Camnet Midday News, but before we go, let's take a look at the headlines once again. Non-state actors advise not to trust politicians. Public health facilities to be fully stocked with medicines end of this week. Thank you for joining us on our Midday Camnet News. My name is Amazing Katamanda. Good afternoon.